So I got hired June of 2014, and I had worked at a few offices previous to that, moved around, was not from the area. And so the previous dentist I worked for was very different from Dr. Patel. So when I first got hired and met her, I knew it was very, very different. The culture here was different, the technology, just her personality in general. Number one, I'm kind of OCD with cleanliness, and so it was really clean and neat and just modern looking. So that was a big deal. And then also technology-wise, a lot of places are not nearly as advanced. So one thing Dr. Patel really focuses on is bringing in that new technology to help the patient as best she can. She always wants to be on the cutting edge so that if a patient comes in with something that is maybe more difficult or something that we've never seen before, she's already learned about it and can say, okay, this is what we're going to do next. So those were probably the biggest differences. That and just the warmth of the office in general. There can be a lot of cattiness, and that was not here, which was really, really refreshing. And it was also a place to grow. Hygiene is something that you do the same thing over and over again, and so it can get a little mundane. And it was a place where she's always challenging you to be a better hygienist or better your skill, and that was really a big deal to me. So she definitely puts a huge emphasis on technology and challenging us. When I was here, it was more in the works of let's take trips together and really go as a unit to those places. That didn't happen while I was here. However, if she went somewhere, we always had a team little huddle afterwards to say, okay, this is what I learned and this is how we can implement it. So that's how it worked when I was here. I liked that because even though she was going to a course for like highly advanced dentistry, as a hygienist who's technically just cleaning teeth, I was learning the same things. And so I never considered myself just a hygienist. I was a practitioner here, and that was really important. You feel the value of that, and she puts the value in that as well, and makes the patient's experience even better because you're confident in your own skill. So I remember in my interview talking about, I think it's really important to have a patient experience. That's what the people talk about when they leave. You know, it's not what you say, but how you make them feel. And Dr. Patel was totally in line with that. She said, yes, that's exactly the culture that we have here. So her learning and expanding our growth and her own is to better the experience from the patient standpoint, whether it's the warmness and the culture, to us really caring about who they are, to, you know what, your mouth, as mundane as it may seem, is really important to us, and it's the portal to your health, and they get that while they're in the chair with us. We care about their teeth and their health, but them as a person as well. And she always really taught us and actually really mirrored that for us as a leader. So I would say the patients see that, and they see the interaction we have, which makes them even more comfortable. So Dr. Patel as a person, first and foremost, is caring. Her personality is so fun. So I really loved seeing that in my first interaction with her. But as a dentist, she is incredible. I really have worked for quite a few people, and I haven't seen anyone's quality or even the amount of detail she takes into what she does. She just really, really cares. And so when you put those two together, you get an outstanding result, and that is exactly what Dr. Patel is.